Any woman with a cervix starting at age 21 up through age 65 needs a cervical cancer screen. In the 20s, we'll screen every 3 years as long as it's normal. And then in the 30s and up, we can combine the Pap test with an HPV test, human papillomavirus, and if both are negative, we can go every 5 years. HPV, human papillomavirus, is a newer screening technique. We've only added that on to the Pap smear test within the last 10 to 15 years. And it's because we have found that that particular virus is more predictive of cervical cancer than just looking at the cells alone. It would be very unusual to have cervical cancer without HPV, and it would actually be a different type of process that would be going on from the normal type of cervical cancer. If you have an abnormal Pap, we'll move on to colposcopy, which is where we actually take biopsies of the cervix. And that's done in the clinic. It's very similar to the pelvic exam that we do with the Pap test. Most of the time, we're finding precancerous lesions with the colposcopy, but if God forbid we found an invasive cancer, we would get you to one of our gynecologic oncology surgeons to talk about hysterectomy. And then they would talk if it had spread outside of the cervix, would you need any radiation, things like that. Again, if you've been screened regularly, then it's really rare to need adjuvant treatment outside of hysterectomy. Usually we can take care of it with surgery alone. But your cancer surgeon would talk to you more about what you would need at that time. It's a pretty quick test. You'll come in and see your physician in the clinic, and you will undress from the waist down so that we can do a pelvic exam and look at that cervix, which is the bottom part of your uterus. And we just brush the cervix for cells and send it off to the lab to look for any abnormalities of the cells, or to also see if there's any human papillomavirus present. Usually within a few days, I have results back. I tell my women if I don't talk to you within a week, give our clinic a call just to make sure that nothing was missed, but it's usually pretty quick turnaround. We try to prevent human papillomavirus, and that's a sexually transmitted virus, but it's very common. And sometimes we clear that virus on our own, like we would clear a cold virus. But anything that we can do to prevent that transmission, so using condoms is a way to prevent that transmission some. It's not perfect because it can be a skin-to-skin contact as well. It has been shown that not smoking can allow our immune system to clear the virus better than if we smoke. Cervical cancer is a very preventable illness. It's a very slow-growing cancer, so as long as we're screening you every few years, we'll catch it before it gets to the cancer state. Usually where we see cervical cancer is women who have avoided their screens for 20 years. Those are the sad cases where it will slowly grow to the cancer state. So we can catch it way, way before that as long as you're being screened.